Good afternoon, everybody. So it is 2 o'clock, so we're going to get started here. So we appreciate you guys coming to this general Medicare overview. So we're going to talk about Medicare and all the different parts and things like that. So have a lot of good information for you guys. But before we get into that, I'm going to bring up somebody from our credit union, Emily Miller. She's going to give you guys an update on some credit union things happening here at Landis.
Hi, everyone. My name is Emily Miller, and I am the Member Relations Manager based out of our Mount Joy, Pennsylvania office. And coming soon, January 5th, 2026, our Landis Homes office. So hopefully you may have seen or gotten the news that we're actually opening a credit union branch at the beginning of the year here in Landis Homes. So we're excited to bring more Everence services to you and to hopefully help out your banking needs as well as your financial services needs. So I will be here all afternoon while this seminar is going on, and I would love if you have any questions or just want to learn more about the credit union to visit me in the back. But we're really excited, and we're really excited to support Landis Homes residents. And if you have any questions, I'd be happy to answer. Thank you.
Thanks again, Emily, and some exciting news to further our relationship here with Landis. So as I mentioned, today's going to be a general overview of Medicare, so we appreciate you guys taking the time to come out and listen to everything we have to say here. So Bailey and I, my colleague here, are going to be walking through this information with you guys. The information that you guys picked up should be a participant guide, which has a lot of the info that we'll go over. There's also a note sheet there for you to take any notes or jot down anything. So for those who are on Medicare, this is going to be a good refresher for you to get just renew yourself with the understanding of everything how Medicare works. And then at the end, my colleague and Bailey and I will be here to answer any questions that you guys have. We're also going to stop periodically for some general questions. So as I mentioned, Bailey and I will walk through the information with you guys here. As you can see, my name is Kyle Sadorf. I am a financial representative with Everence. I'm based out of our Lancaster office, but I also hold office hours here at Landis, and that's the second and fourth Tuesday each month from 1 to 4. So a little background is I earned a bachelor's degree in business administration with a concentration in finance and management through Geneva College, which is out in Pittsburgh. I grew up in Ephrata and currently live in that area today, and I've been with Everence for 2 years next month. And as I mentioned, I'm here with my colleague Bailey as well. So she's been with Everence for 7 years and in the industry for about the same time. So many of you are probably familiar with Everence, but if you're not, Everence is a faith-based financial services organization, and our mission is to work with our clients and empower their financial well-being so they can live a faith-inspired life. We have been helping people make decisions about their money that reflects their faith and values for 80 years. So we offer banking, retirement planning, insurance, and other financial services in ways that encourage stewardship and generosity. Everence also serves clients in all 50 states, and we do have several locations around the U.S. So we also offer services for individuals, businesses, nonprofits, and churches. That includes our savings and checking through our credit union, investing in asset management, protection for your health and family through insurances, financial planning, and multiple charitable services. So for the businesses, nonprofits, and churches that we serve, we offer employee benefits, investment management, and gift management. So we not only want to help people make a difference in their own stewardship journey, but also make a difference in the lives of others. So through our sharing fund, our My Neighbor credit card, community development investing, church loans, and charitable services, these are the ways that we help people and help our clients, not only their communities, but those around the world. So before we get into the specific details of Medicare, we'll take a quick moment to talk about kind of retirement and some questions that you have in retirement years and leading up to your retirement years. So you may have goals to check some things off your bucket list. You maybe want to pick up a different part-time job, do some volunteering, or maybe just spend time with friends and families. So today, again, we're gonna check that refresher of Medicare and all that information off your to-do list so you guys can start moving on to some of those other things you have such a big desire to do so. So as you all know, being eligible for Medicare significantly changes your health options. So the insurance you may have while you're working or may still have is likely comprehensive, but Medicare is broken down into different parts. So we're going to go over each parts so you guys can clearly understand what you have, the coverage you have, and the financial impact of those choices. So if you ever Googled Medicare, you probably discovered that it's very complicated, but while Medicare is complicated, we're here to ensure that you guys can get through it, and we're here to help you guys. So the information in the workshop is organized into 4 different steps to go on to Medicare. We'll go through each step, and you'll learn what you need to know and when you need to know it. So those important facts about Medicare are going to be in that participant workshop. So you don't have to write everything down that you hear. Feel free to just sit back and take and listen. So there's much Medicare information that is going to apply to you. There's some that won't. For those specific situations that you have, feel free to reach out to us, see us afterwards. We're happy to connect with you and answer any of those questions. So as I mentioned, we're going to go through 4 steps. We'll go through each step, discuss the information you need to take that step, and what all you need to know about it. So the first step is we're going to go over the parts of Medicare. So there's 4 parts. We'll go over each of them individually and discuss what they cover and what they don't cover. Step 2 is going to be choosing your coverage path. So as many of you know, Medicare doesn't cover all medical expenses, so we'll look at options to make sure you'll have all the coverage that you need. Step 3 is we're going to go on how you enroll and when do you enroll in Medicare. And step 4 is going to be actually enrolling in Medicare. Alrighty. So step 1 is we're going to understand the different parts of Medicare. So this is going to give you a good background on what you already have if you're on Medicare and all the different workings of each part. So as you know, there's 4 parts. The health insurance that you probably have while you're working or you might have today, probably through like an employer, is likely comprehensive. It doesn't have coverage broken into those different parts. So once you're on Medicare, each of these parts are going to be available for you to have. So the reason why there's these different parts of Medicare, it's because each part represents a different expansion of Medicare over time. So each expansion is now a part, like Part C or Part D. So Part D, for example, has been recently added in 2006, is the newest one. So they just added Part D. So there's 4 different parts that we'll go over. Part A is going to be hospitalization. Part B covers your outpatient care. Part C is private company insurance alternatives to Parts A and B. And Part D is going to cover prescriptions. So a good device that I tell people to remember what these different parts mean is, I think A is admission to a hospital. B is going to be your basic outpatient care. C is going to be your private company insurance. And D is the easiest one, that's your drug plan. So we're going to go into more details of each part, and we're going to begin with Part A. So as you may know, Part A is going to be what helps you pay for care you receive in a hospital and follow-up skilled nursing care that you may need after a hospital stay. So Part A is free insurance for most people. Once you sign up for Medicare, most people don't have to pay a premium for Part A coverage. And the reason is because all those taxes that you pay during your working years, they go to make Medicare Part A premium free for you. So Medicare covers most, but not all costs while you're in the hospital. You are responsible for part of the costs, and that depends on how long you stay. So when you first go to the hospital, there is an initial deductible that you would be responsible to pay first. For 2025, that's $1,676. If you do have an extended stay, which fortunately is rare these days, then you also have daily amounts that you would be responsible for. Skilled nursing care under Part A is specialized care one might need after a stroke, heart attack, or a surgery. Now, this is rehabilitation care, and it's only available after a 3-day hospital stay, and it's only for a short period of time. I'll mention nursing home care here. Many people assume that Medicare will pay for their care if they receive home care or move into a nursing home. That's not accurate. Medicare is only going to cover that skilled nursing care that we just talked about. And then with home health care, this is going to be similar to skilled care. So it's for specific needs such as physical therapy, occupational therapy, and speech therapy. And again, it's only for a short period of time. So that's going to cover Part A. So Part B is really where the bulk of your coverage comes from in Medicare, because this is your outpatient costs. So unlike Part A, Part B has a premium that most of you may have realized. So for 2025, that general premium is $185 per month. Part B also has an annual deductible. So for 2025, that deductible was $257. Once you meet that deductible, Medicare is going to pay for 80%. You'll be responsible for the remaining 20% of costs. Now, you can choose to not have Part B. It's technically optional under Medicare. However, most medical care today is done in the outpatient setting. So, therefore, Part B is still technically optional, but it has changed to more of a requirement because of the way care is received nowadays. So here are a list of some of the services that are covered under Part B. So that'll include services from doctors or other healthcare providers. It'll include any outpatient care. It'll include some home health care, durable medical equipment, so think wheelchairs, oxygen tanks, things like that, and many preventative screenings like shots, vaccines, and yearly checkups. So Parts A and B don't cover all types of medical treatment, though. This can include like acupuncture, glasses, hearing aids, and over-the-counter medication. There is that participant guide you have has a more complete list of all the things that Part B or Part A and B wouldn't cover. So the two parts we just talked about, Parts A and B together, are also called Original Medicare. So when you hear the phrase Original Medicare, know that you're talking about Parts A and B, and these two parts are going to be what make up the core of your benefits through Medicare. So Parts C and D are newer additions that have been added in the past 25 years to Medicare. We're going to start by talking about Part C, which is commonly known as Medicare Advantage, or a private alternative to Original Medicare. So under Advantage Plan, what Medicare does is that they contract with private insurers to cover what it would normally cover under Parts A and B. So the insurer receives funding directly from Medicare, and then that insurer is going to pay your claims now, not Medicare. There are many different Advantage plans with different levels of coverage. At the most basic level, Medicare requires Advantage plans to cover everything it would in Parts A and B. However, the private insurer can make different decisions about whether it'll cover a medical expense than what Medicare would make. So they can make a different decision than what Medicare would decide. Advantage plans also may help cover prescription drugs and other care such as dental and vision. While Advantage plans are substitutes for Part A and B, you're still required to pay that Part B premium to Medicare. So you'll also see that there's an Advantage premium, which varies depending on the insurer and what level of coverage that plan offers. There are zero premium Advantage plans that cover Parts A and B costs, typically without any additional coverage. So these plans also can have some additional out-of-pocket costs associated with them. Now keep in mind that even though these plans say zero premium, it does not mean zero cost. So you're still paying that required Part B premium and any additional out-of-pocket expenses. The biggest piece I like to stress about the difference between Original Medicare and Medicare Advantage is that you are working with private insurance companies. That means you have to navigate providers and making sure that you are having doctors that are within those networks. You're also at the liberty of the insurance company's decisions on whether it will cover a medical expense or not. All right. So now the last part here is Part D, which is your prescription drug coverage. So Part D plans are offered through private insurance companies as well. These companies, again, are contracted with Medicare to provide just your prescription drug coverage services. The annual open enrollment period for Part D takes place every fall, as you may know, from October 15th to December 7th, so coming up here next week. During this time, you do have the option to switch plans that you're on, right? Take a look at what you're currently on, take a look at your prescriptions, and with the option to switch for next year. We are doing so like I mentioned earlier, this is going to be a general overview of Medicare, but in 2 weeks, we'll be doing a Part D specific seminar to really go into the details of that with open enrollment coming up here. So another thing is credible coverage. So this is a term you may have heard, but credible coverage for Medicare Part D means that your existing prescription drug plan is expected to pay as much as the standard Medicare Part D plan. So having credible coverage allows people to delay enrolling in a Part D plan without facing any type of penalty. So if you're not on Medicare and you're on a different type of plan, and it's considered credible, you can keep it without worrying about penalties when you do decide to join Part D later. Non-credible coverage that doesn't meet Medicare's standards will mean that you'll likely face a penalty if you delay Part D enrollment beyond an initial or special enrollment period into Medicare. So why is this important? Well, you must provide proof of credible coverage if you're delaying enrolling in Part D to avoid the late enrollment penalty. You should receive an annual notice from your insurance company and your insurance provider indicating whether your plan is credible. So keep that document for your records on that information. So if you're not sure if you have credible coverage, feel free to check your plan administrator who is helping you with your insurance. They'll be able to give you assurance of what it is, if it's considered credible coverage. So that covers the first step, which would be those different parts of Medicare. We're going to stop. Bailey's going to come up here to answer any questions you may have. And Hunter, if you do have questions, just raise your hand. Hunter in the back will come around and bring a mic to you.
No questions? Not yet, anyway. Okay, on to the next step.
Cool. All righty. You guys are making it easy on us. All right. So we'll go on to the next step here, which is choosing your coverage path. So we went over the different parts of Medicare. Now we'll discuss the paths that you have. So you have original Medicare, as we talked about, is generally going to cover approximately 80% of the cost of covered services. Therefore, your responsibility is that remaining 20%. It's also important to note that there's no out-of-pocket maximum with Medicare. So in other words, there's no ceiling on what you can spend with Medicare. This is why many people choose to take an additional step beyond just enrolling in Parts A and B. So we'll take a little closer look at these two tracks. So we're going to review what we just discussed to help compare the paths with each other. First, we'll divide the coverage into two tracks. When you're choosing your coverage, you'll head down one of these tracks, right? You're either on the original Medicare or an Advantage path. So the first track is original Medicare, Parts A and B, and two optional choices, which is a supplement plan and a Part D plan. The second track is going to center around Part C or Medicare Advantage. You would not have a supplement plan. Part D may be included, and there may be additional coverage included. The levels and kinds of coverage really just depend on what kind of Advantage plan you would purchase. So each track has a trade-off in between coverage, cost, and convenience, and we'll compare these a little more in details on this slide here. So with original Medicare, Parts A and B, and a supplement plan, there's several benefits I'll discuss. So supplement plans are guaranteed issue so long as you're within your initial enrollment period or your special enrollment period. They provide national coverage. So with supplement plans, as long as a provider accepts Medicare anywhere in the United States, your supplement plan will follow that. There are no networks that you have to consider. So with that, you do have the freedom to choose the providers that you want to see. Supplement plans have lower out-of-pocket risks, and the premiums are going to be level each month. No referrals or pre-authorizations are needed, and they have a standardized plan design, which means that the benefits are determined and laid out by the government. So benefits won't differ from insurer to insurer. The only difference from insurance company to insurance company is going to be the premium rates. So a few considerations to keep in mind when it comes to supplement plans and original Medicare is that Medicare and supplement plans don't cover prescription drugs, and they may not provide any additional benefits like dental or vision. There's also multiple insurers that you'll deal with. Original Medicare will be through the government. Your supplement plan and Part D prescription drug plan is going to be through private insurers. So track 2 there with the Medicare Advantage plan or Part C, some features to be aware of are that they may include added benefits, they may have a lower premium, and sometimes there's those $0 premium plans available. They often include prescription drug coverage, and there's typically just one insurer that you'll deal with. Some considerations to be mindful is that you can be subject to medical underwriting to switch plans. So this is a big one, especially coming up on this time of year. So if you are in an Advantage plan and you want to go to original Medicare and a supplement plan, you would be subject to underwriting. And because of this, and depending on your health condition, it could lead the potential to being denied a supplement plan. You can also have higher out-of-pocket expenses, and you're restricted to a provider network in Advantage plans. So going to a provider out of that network can result in more out-of-pocket costs. These plans also may require some pre-authorizations to visit specialists, possibly delaying your treatment time. So since they do have networks, they only offer regional coverage, not national coverage. Therefore, you may need to shop these plans from year to year, and you're also going to be responsible for some copays involved with them. So I've been mentioning supplement plans. This is something I just want to get deeper into. We've been talking about these supplement plans. So far, we have been talking about parts of Medicare. So now we're going to switch and we're going to talk about plans. So it's important to remember that Medicare supplement has plans and not parts like original Medicare. So when you hear parts, you know that you're discussing original Medicare. If you hear plans, know that you're discussing supplemental plans. So they do have assigned letters. They're designated letters A through N, like Plan A, Plan F, Plan G. Again, not to be confused with Medicare's Part A, Part D, Part C, or B. So the coverage varies, but as I mentioned, supplement plans are standardized. So they exist to help you pay for any remainder of any bill or hospitalization and outpatient care after Medicare has paid its portion. So original Medicare, as I mentioned earlier, has no cap or limit on what comes out of your pocket for the portion of expenses that Medicare doesn't pay for. So for most people, unless you have deep pockets, having only original Medicare is probably not worth the risk taking. Supplement plans help minimize that risk. So a good example is if you had something a service that cost $100,000, Medicare would pay 80%, so $80,000 of it. You would still be responsible for that 20% or $20,000. That's a lot of money, right? But if you have a supplement plan, it can help pay for all of that or a portion of that cost, depending on which plan you choose. As far as the premium is concerned for supplement plans, there's a range of premium rates. It really just depends on how much coverage you need or want. So we'll take a little deeper dive into the premiums and the coverage for supplement plans. So just to review, supplement plans are standardized by the federal government. There's a range of plan choices, A through N, and each of those plans have different level of coverage that they offer. So if you remember when I first talked about Part A, there was that initial deductible of $1,676. If you are in the hospital for 2 days, you are responsible to pay that deductible for your stay. Supplement plans help pay for that portion of these hospitalization costs, like that deductible. So, and the same is true for any of the portion of costs you'd be responsible for Part B. So Medicare supplement includes a variety of plan choices, so you can decide how much coverage you want. Some people I talk to want everything taken care of and never want to see any bills. Some people just want a reasonable out-of-pocket maximum and a lower premium plan. And there's many in-between options. So for example, Plan G is a very popular supplement plan. Some of you may be on it. It offers people turning 65 or on Medicare the most coverage or hospitalization and outpatient expenses. So most coverage for those expenses. Plan G is going to always offer the same coverage regardless of which insurer that you choose. So a good note is that if Medicare won't pay an expense, Your supplement plan won't pay for it either. So supplement plans don't help pay for vitamins, routine foot care, glasses, etc. If it's not approved by Medicare, your supplement plan won't pay for it either. So you have rating choices that can affect your premium. Depending on the supplement plan you choose, your premium could be based on your issue age, attained age, or be community rated. So if you choose a policy that uses issue age rating, your premium will not increase due to your age. You will get an increase annually based on inflation, but you never get an increase on your age. Attained age works is that if you choose a policy with an attained age rating, the premium will be lower initially, then the premium will go up each year based on your age and inflation. So attained age policies cost less at the beginning, but their cost is more over the lifetime of the policy. Issue age policies cost more at the beginning, but their total cost is less over the lifetime of the policy. Now, community-rated plans, they work similar to issue age-rated plans. Many of them have an enrollment discount that will diminish over time, so the premium goes up as that discount diminishes, and it will also increase due to inflation. So just to repeat, all policies, regardless of their rating system, will adjust annually. We'll adjust the premium annually on the cost of inflation and the cost of medical care, but some premiums will rise faster due to other factors. So this is a good visual for you guys to take a look at that shows really the difference between issue age and attained age. So issue age is going to be represented in blue, while attained age is in orange. So to repeat, issue age will start out with a higher initial premium, but is more stable over the life of the policy. Attained age will start out with a lower initial premium, but will increase more over the life of that policy. So this is a really common question that we get, especially throughout the year and during this time of the year during open enrollment is, can I change plans? So you can move from a Medicare supplement plan to an Advantage plan during the annual open enrollment period with no health questions asked. It's typically a guaranteed transfer. However, moving from an Advantage plan to a supplement could be a little more challenging. If you take an Advantage plan and continue with that plan for more than 12 months, and then you decide you want to transfer to a supplement plan, you will have to go through a full medical review, and depending on your health condition, you could be denied coverage, which means that you're again locked into that Advantage path. One thing I often hear people in the industry is if I take an Advantage plan now while I'm healthy, then I can always switch back to original Medicare later. This is true, but keep in mind there's a lot of out-of-pocket costs that you are responsible for under just Part A and B. As I just mentioned, if your health is not in great condition, when you want to switch, you can run the risk of not getting on a supplement plan to help cover those higher out-of-pocket costs. Here's an important note that for those who may be on an Advantage plan for more than 12 months and you want to add, if you've been on an Advantage plan for more than 12 months and you want to add a supplement plan, you'll need to pass medical underwriting. So I just want to make sure that is emphasized, especially during this time of year. So yes, you can always try to move back to original Medicare, but it's not always a guarantee that you get a supplemental plan. Another thing is that you can always change your supplement plans throughout the year. One common question that we get from people is people who are maybe on an attained age plan, and they want to take a look at potentially seeing if there's a lower premium due to the issue age rating, right? So we have conversations a lot during this time of year to take a look at people's existing supplemental coverage. Anytime you change supplement plans, so anytime you change from different insurance companies, you're always going to still have to go through medical underwriting. So if you are on a supplement plan and maybe the premium is rising and you want to talk about, what are some other options to have a lower premium, feel free to reach out to us. We're happy to have that conversation with you. Just a reminder, if you try to change insurance companies, even if you're on supplement plans, that change will still cause a medical underwriting need. So that covers the second step with the different paths between Medicare Supplement and Medicare Advantage. We're going to stop here again for questions. As I mentioned earlier, just raise your hand and a mic will be passed to you. Oh, yeah, I think he's coming right behind you there.
So the traditional, or whatever the AB traditional, that never covers dental, vision, anything like that. So no supplement plans would cover that then too? Is that what you're saying?
Correct, yes. Because Medicare doesn't cover it, then the supplement plans also won't cover it.
So the only way to get that would be through the Advantage.
Through through the Advantage path, or you can always purchase dental and or vision as a separate standalone plan. Vision is relatively inexpensive. Dental is kind of a different story. But you're not bound by certain enrollment timelines like you are with Medicare for them, so they can be purchased really at any point in time.
Thank you.
Any other questions?
Somewhere I saw that you say that Medicare begins at 65. I thought that went up to 67. Did that not change?
So the requirement for when you can enroll in Medicare is age 65. 67 is the full retirement age for those who are born 1960 or later. So full retirement age deals with Social Security specifically when you're eligible for your full Social Security benefit. That doesn't have to do with your eligibility for Medicare at age 65. Does that answer your question?
So as I understand you now, Medicare is 65, but Social Security not till 67. Is that correct?
You're eligible for Social Security at age 62. So if you are eligible for Social Security benefits, you can take it as early as 62. However, you have to wait until that full retirement age to get your full benefit. If you take your full benefit before your full retirement age, or if you take your benefit before your full retirement age, your benefit actually gets reduced, okay? So you're eligible for Social Security at age 62. Generally speaking, if you can wait to your full retirement age, that would be our general guidance. That way your benefit it's not deduced. And if you would take a lower amount, that amount stays lower for the rest of your life. So if you can wait to your full retirement age, that's generally the path that we advise people to go. So that's sort of Social Security versus Medicare. The wonderful thing is it all happens relatively close to each other. So Medicare eligibility is age 65. Social Security eligibility is age 62. Full retirement, again, that's for those born 1960 or later, would be age 67. Anybody born before 1960, it's based usually between age 66 and 67. And again, it goes up about a month for every year. So if you have additional questions for those specific amounts, we can help you.
Will Everence supplement plan change in terms of premium or coverage?
What was the first part of that question?
Will Everence supplement plan change in its premiums or coverage?
Yes. So for Plan G, your premium's based on how old you are. Okay. So we could talk specifically about what that's going to look like for you. You're on Plan G currently?
I have supplement plan, but will that change in cost or coverage?
Yeah, Plan G being an issue age plan, so at least here at Everence, our rating cycle runs April 1st to March 31st every year. Other companies, it's different times of the year. Sometimes it's January 1st to December 31st. So for what that means for you is if you have a supplement plan that is looked at and evaluated once a year. So here at Everence, we'll look at that usually in January. And then you would get a notice at the end of February if your rates are going to change for that next rating cycle. You're welcome. Anything else? Okay.
All right. So we're going to go into step 3 here, and this is going to be talking about how to decide when someone should enroll in social or in Medicare. So as you approach your Medicare eligibility age, which again would be 65, there's some questions people should be thinking about. It should be, are we going to enroll in Medicare? Are we going to apply for Social Security? Or are we going to wait and delay Social Security? Are we going to be continue to work past 65? Or is that going to be full-time? Is that going to be part-time? So answering some of these key questions is going to be the starting point before someone looks at all the other information that we went over when they first try to go onto Medicare. So once those questions are answered, then you'll have your action plan and can move on to the next steps. So a common question we get at this step is, how does this work with Social Security? So you're eligible for Social Security and Medicare, as we've talked about, at different times. They're two separate programs, but their enrollment is intertwined. So if you plan to enroll in Medicare at 65 or whenever you do, you need to know how enrollment in both programs is connected. So when you sign up for Social Security, and if you're not on Medicare, the government will automatically sign you up for Medicare Part A when you're eligible. So essentially, the government is deciding when you enroll in Medicare. However, when you sign up for Medicare, you won't be automatically signed up for Social Security. So if you haven't signed up for Social Security, but you're considering signing up for Medicare, one of the next most important factors to consider is if your current employer situation and your current health coverage. So reviewing whether you plan to continue to work past 65 and the type of health coverage you have are both critical factors. So as I said, Social Security and Medicare, they're two distinct programs. So Social Security provides income benefits primarily for retirees with disabilities and for retirees, people with disabilities, and survivors. Medicare is the federal health insurance program for individuals 65 and over and some younger individuals with disabilities. While they are separate, enrollment in one can affect the other. So enrolling in one does not require enrolling in the other, like we're mentioning. Some people delay Social Security, but they'll still sign up for Medicare. Others may start Social Security early and automatically get enrolled in Medicare later. So if someone were to begin Social Security at age 65, they are automatically enrolled in Medicare at 65 in Part A and Part B. Someone at 65, if they're automatically getting enrolled in Medicare, does have the option to decline Part B. Since Part B has that monthly premium, you can choose to return or decline Part B if you have other coverage at that time. So what declining Part B for someone would look like is just they would have to enroll later, and depending on circumstances, they could face a late enrollment penalty. So if there's someone in that situation, you really want to consider those options. So if you begin Social Security at 65, you are automatically enrolled in Medicare Part A once you start on Social Security. Part A is usually premium free, as we mentioned. So if you and your spouse have paid Medicare taxes for the past 10 years while you're working, that Part A is premium free. Part A is tied to Social Security benefits. So you cannot opt out once you start receiving Social Security. So nobody can opt out of Part A if they decide to take Social Security. If you're enrolling in Part A, you can also no longer contribute to a health savings account. Some people delay Social Security and Medicare Part A if they have an active employer coverage and want to continue their HSA contributions. So this is a good flow chart that we'll walk through to help determine some of the answers of initially getting enrolled in Medicare. So one of the first questions we want to address is whether or not you plan to continue working when you turn 65. That answer is no. You'll need to enroll in Medicare. If you don't plan on working, you need to enroll in Medicare at 65, or you could incur a late enrollment penalty. So for people who say, I'm retiring at 65, they're going to have to enroll in Medicare, or you can have a late enrollment penalty. If you do plan to continue working, the next question is if you're covered by a large or small group employer. So a large group employer is considered to be an employer with 20 or more employees. If that answer is no, and you work for a small group employer, you'll need to enroll in Medicare at age 65, or you could incur a late enrollment penalty. Now, you do have the option to retain your group health plan as secondary insurance, but Medicare would be your primary coverage. If you work for a large group employer and you're covered by them, the next question you'll ask is, are you contributing to a health savings account or an HSA? So if you do not have an HSA, your group health plan would remain primary and you could enroll in Medicare Part A. If you do have a health savings account, your group plan remains primary, but it may be wise to hold off enrolling in Medicare Part A. And that's because once you are established in any part of Medicare, you can no longer contribute to an HSA. So you can always use the funds that are already in the account, but you cannot add any additional funds. That is considered overfunding per IRS guidelines. So important thing with the HSAs is that if someone's delaying Medicare past age 65, they want to make sure that they stop contributions to their HSA plan at least 6 months before they go on Medicare. The reason is that when you enroll in Medicare Part A, you will receive up to 6 months in retroactive coverage. So if you haven't stopped contributions 6 months beforehand, any contributions made within that 6-month period will be considered overfunding per the IRS. If you're no longer contributing to an HSA and you enroll Medicare Part A while working for an employer with 20 or more employees, you do have the option to delay enrolling in Medicare Part B. Once you come off your group health plan, that's usually upon retirement. That's when someone can sign up for Medicare Part B. So this takes us to the different enrollment periods. So you are required to enroll within one of the 3 designated enrollment periods. So your initial is, you may want to, so there's 3, initial, special, and annual enrollment periods. So you want to make sure you understand the rules of the initial enrollment period. Even if you plan to just continue on your work coverage, it's important to know how this enrollment period works. Sometimes it may be best to have both employer coverage and Medicare. The special period is for people who have postponed all or part of Medicare coverage, but are leaving employer coverage after employment, and that's after age 65. The annual period should be relied on primarily for switching among different plans and not for your first time enrollment into Medicare. If you wait for the annual enrollment period, you are much more likely to be subject to penalties. Part D is sometimes neglected by people who aren't taking medication. So you may say that, I'm not taking any prescriptions, so I don't need to enroll in a Part D plan. But if you do have something come up where you're going to have to start taking regular prescriptions and you wait to enroll in a Part D until then, you will pay a late enrollment penalty as part of your premium for as long as you're on Part D, which could be the rest of your life. So to avoid that penalty, if someone isn't even on any medications, we tell them to consider signing up for the least expensive Part D plan. That is really just to protect yourself from a possible penalty in the future. So you may be asking, why are there these deadlines? Why are there these penalties? All insurance plans, including Medicare, depend on people paying into the system while they're healthy. So there are funds available when people are not healthy anymore. If people only signed up for insurance when they were sick, the insurance plan would fail because more dollars are just simply going out than would be coming in to help pay for the claims of those people who are sick. So this is more of a deeper dive into each enrollment period. So the initial enrollment period for someone first turning 65 is a 7-month window. It's 3 months before you turn 65, the month you turn 65, and then 3 months after you turn 65. Because of Medicare limited enrollment periods and the penalties that you can have if you enroll in outside of the initial or the special, you're best off beginning the process around 3 to 6 months before you plan to enroll. If you do have a health savings account or an HSA, you may want to start 6 to 7 months beforehand. There's some additional steps people in that situation will have to go through. Biggest thing is just making sure you have enough time for these enrollments. So this is a good example of how the initial enrollment period would work. So let's say your birthday is in June and you can enroll in early as March 1st. So if you enroll in March, April, or May, your coverage is going to begin June 1st. If you enroll in June, July, August, or September, your coverage will begin the following month. So remember, the initial enrollment period is a 7-month window to enroll in Medicare without penalty. That begins 3 months before 65, the month you turn 65, and then 3 months after. 3 months after. So the special enrollment period, so let's say you decide to work past age 65 and you're staying on your group employer health plan. Once you leave your group health plan, you have 8 months to enroll in Medicare Part B without a penalty. Keep in mind that when you enroll during this special enrollment period, there is additional form that you'll need to submit showing that you've been covered under an employer health plan past age 65. The last one here is the annual enrollment period. So let's say you missed the initial enrollment period, you didn't qualify for a special enrollment period. If you want to enroll in Medicare, you'll have to wait for the annual enrollment period that runs from January 1st to March 31st every year. Your coverage will begin the month after you sign up, so keep in mind that there likely will be late enrollment penalties, so please do everything you can to avoid signing up during the annual enrollment period. The biggest thing with all these enrollment periods is just give yourself plenty of time. Make sure you're having those conversations early enough. Even if you're looking at switching or anything like that, give yourself plenty of time to have those conversations. So before we answer any questions on that step, I want to touch on health plans that employers may offer to the retirees. So some people may be on a retiree health plan. So if you're over 65, no longer working, this is something that your employer can offer you, a retiree health plan. It's important to know that a retiree health plan is not considered employer coverage. So that doesn't mean that you have guaranteed transfers of coverage. So with this, it's important to get an understanding of how your plan works with Medicare so you can avoid any coverage gaps or any potential penalties. So we'll stop there again. Does anybody have any questions on that information I just went over? All right, perfect. So this is the last step here, which is going to be for those like, how do you sign up for Medicare? So you've been taking Social Security benefits before age 65, like we said. The government assumes that you want to begin Medicare as soon as possible. So with that, you're automatically enrolled in Medicare when you're initially eligible at age 65. So there's no action someone would need to take to sign up. The Medicare card will show in the mail 3 months beforehand, and then if they really don't want or need Medicare Part B, they can opt out by returning that Medicare card. If you're not taking Social Security and you want to sign up at age 65, going through ssa.gov over the phone or talking over the phone or going in person to your local Social Security office are ways you can sign up. We found that the quickest way to get some things done with Medicare is through ssa.gov, but you can also call them or set up an appointment in person. If someone plans to work past age 65, they'll have a slightly different Medicare enrollment process to follow. They'll still follow the same enrollment methods as someone signing up at age 65. So that would be they can go online, they could go over the phone, or in person to a local Social Security office. There's going to be 2 Social Security forms that they'll need to complete. One form you'll complete yourself, and that communicates with Social Security that when you want to be on Medicare. So the one form communicates with Social Security and when you want Medicare to start. The other form is going to be completed by your employer through which you get insurance coverage, and that provides proof that you had credible coverage past 65. So if you're over 65 and you have a health savings account, you'll want to stop contributing to your HSA 6 months before enrolling to avoid those potential tax penalties. Perfect. Alrighty. Signing up. Yeah, so after you enrolled in Medicare Parts A and B, you can decide whether to sign up for a Medicare supplement plan and a Part D prescription drug plan or a Medicare Advantage plan. Generally, again, those are going to be the 2 avenues that you'll go through. And as I mentioned, you can do Parts A and B, enroll through Social Security, ssa.gov. Part D is going to be a plan through a private insurance company. Supplement plans are going to be through a private insurance company, and also you have your Advantage plan as well. So the biggest thing we want to stress here is that getting everything established for Medicare it can be overwhelming. So like I mentioned, we're here to help you guys out with you have questions on your current Medicare coverage. If you have questions on some things you're getting from Medicare, right, please feel free to use this as a resource. We're happy to go over, the situations and go over some of those details if you wanted to take a look at switching or how your current Medicare coverage works. All right. And the last piece here is our goal is to help make Medicare an easy choice for you and kind of a smooth process for you. But if you guys have any other questions, whether it be retirement or anything like that, feel free to use this as a resource. Again, we are here to help you guys in any way with this whole process of Medicare and retirement. So that goes through all the information that we have for today. We'll open it up one last time for any general questions that you have. As I mentioned, we will be sticking around here to answer any specific questions that you guys have. All right. Seeing that there is none. Well, we just want to thank you guys again for letting us come out and do this general overview of Medicare. As I mentioned, we will be back here in 2 weeks to go over Part D specifically and kind of the ins and outs with that and navigating that. So feel free, please come back and join us for that talk. It'll be a lot of good information with open enrollment coming up here. But thank you guys. And like I said, if you guys have some questions or anything like that, please stop by the table, come see us afterwards. We're happy to talk with you guys. Thanks again.